Hi, Lorne Brown here from AcuBalance Wellness Center. I'm a doctor of traditional Chinese medicine, and I want to simplify the fertility treatments around intrauterine insemination, an IUI, a superovulation, and an in vitro fertilization. And so I like to use the metaphor, and patients ask me kind of what's the difference, why would I do one versus the other? And let me add right now that everything is very individualized. So you do need to speak to your healthcare provider. You want to talk to your IVF doctor, that's the reproductive endocrinologist, what is best for you. This is in general how to understand the differences between the three procedures. So in natural intercourse, if we're going to use the metaphor of playing darts, and your dart is the sperm, and the bullseye of the dartboard is the egg. So in regular intercourse, you have a line, you don't cross that line, you throw the dart hoping to hit that bullseye. That would be natural, trying to conceive naturally, natural intercourse. If you did an intrauterine insemination, where they take the man's sperm, clean it, and then with a syringe, inseminate the woman, so they put it into the woman, so it spills into her uterine cavity up to the tubes. What we're doing there, if we're going to continue with our dart analogy, is you still have your one dart, but you're stepping over the line when you throw that dart into that dartboard, into that bullseye. If you're going to do a superovulation, actually, if you're going to continue with the IUI, before we do superovulation, some people do medicated IUIs with ovulation drugs, like a drug called letrozole or clomiphene. So in that case, you're still stepping over the line with the IUI part of it by throwing the dart. And now you're getting, hopefully, 2 bullseyes, maybe 3, but ideally 1 to 2 bullseyes. So 1 to 2 eggs will grow. So now when you step over that line, you have 2 bullseyes to choose from, or increases your chances of hitting that bullseye. In a superovulation, now you're taking injectables. So you're injecting yourself with these medications, very similar to the drugs that are used in an IVF, just at a lower dosage. And this will cause 2 or more follicles to grow again. And so again, you're stepping over the line, but again, more chances of more bullseyes. And so it just increases your odds that much more when you throw that dart. If you go into an IVF, now what's happened is they grow several follicles. Several follicles grow, and they retrieve the eggs, and then they take the sperm and put several sperm in each petri dish, hoping they will fertilize those eggs. So from our dart analogy, again, our dart game, what you're doing now is you're getting really close to the dartboard. You're like right next to it. And now you have several bullseyes to throw that dart into. That would be the idea. If you did an ICSI, then in an ICSI procedure, it's just like an IVF. From the women's perspective, everything happens with the drugs and the retrieval is the same, except rather than putting the sperm in the petri dish and allowing the best sperm to inseminate, to fertilize the egg, they will choose one sperm and inject that sperm into the egg. And so from our dart analogy, now you're taking your dart and you're literally putting it in to each of the bullseyes. And so that's how you differentiate between an IUI, a medicated IUI, like an ovulation drugs, letrozole or Clomid, to a superovulation, to a IVF or even an ICSI procedure. And when you compare the IVF with the superovulation, because this is the most common question I have of, I've done some IUIs, medicated IUIs, I don't know if I should go into a superovulation or right into an IVF. Now, it's always an individual decision, your decision, and I will share with you some of the discussions I've had with the couples I see and the women I see. For myself at this stage, being in practice since 2000, personally, and again, this is me, so you have your own spiritual, religious, social, and economic circumstances of what procedure you're going to choose. I'm going based on what I know from working with IVF clinics since 2000 and what I know from a Chinese medicine perspective and all the women I have treated over those years. Personally, I would go from an IUI to an IVF procedure. I would skip the superovulation because in an IVF, the success rate is usually so much more higher than in a superovulation. Also, the risk of multiples is less. So when you do a superovulation, you could grow 2 to 4 eggs, follicles which contain eggs or more, and they inseminate you. So there's no control of how many pregnancies you have. They inseminate you, and so you could have 3 or 4 pregnancies, and that puts you, the mom, to be at risk, and also the baby's at risk. In an IVF setting, they can choose to put back just one embryo, which reduces the risk of multiples. And also in an IVF, which you don't have in a superovulation cycle, in the IVF process, because they can see how many eggs are mature and look at the quality of the eggs visually, and because they can see how the embryo grows out, and they can even do genetic testing to look at your embryo to see if it's chromosomally normal, there's a diagnostic aspect to IVF that you don't get in a superovulation or in a regular medicated or non-medicated IUI. So personally, taking money and spiritual, social reasons off the table, just based on the success rate and based on the diagnostic ability of IVF and based on the lower risk of multiples compared to superovulation, that's where I would tend to. Now, at AccuBalance, we support you in whatever your decision is, and whether you are trying to conceive naturally, or you're doing a medicated or non-medicated IUI, or a superovulation or IVF ICSI, contact AccuBalance if you're looking for support to improve your chances, whether trying to conceive naturally or with ART such as IVF. Thank you.